Hello guys, welcome back again to real life based clinical case scenarios. So today we saw a pediatric patient, 12 years old girl, who was suffering from sickle cell anemia. Okay, so in sickle cell you have trait and you have anemia. So if your both mother and father is having a trait, the child have the chances to get the anemia, and she was from the community in which the consanguineous marriages are more common. So she was having sickle cell anemia, in which hemoglobin is replaced by HbS hemoglobin. So the normal hemoglobin is HbA, but it is replaced by HbS, and which is less soluble. And also normal red cells are of the biconcave shape, but in sickle cell anemia the red blood cells take the shape of the boat. So it is very hard for these RBCs to pass through the capillary, and then they get obstructed. They sequestrate and they cause obstruction, and that causes the pain, vaso-occlusive crisis, and aplastic crisis. Also, normal signs and symptoms of sickle cell anemia are anemia, mostly jaundice. It could be splenectomy, autosplenectomy, and you are more prone to infections because your spleen is not there, so you can get infections from the encapsulated bugs. She was diagnosed with sickle cell anemia when she was 3 years old, and since then she is taking blood transfusion every month. Like her mother told that every 25 days she has to be admitted in the hospital and she has to undergo blood transfusion. Due to this many blood transfusion, her iron level is very much increased and her ferritin level is very much increased. So the normal ferritin levels are 7 to 140 Ng per ml for the children. And could you imagine her ferritin levels? Her ferritin level was 7,000 and something, because she is on blood transfusion since so many years. She is on desferrioxamine, which is the antidote of the iron. So before marriage, it is must to check that whether you are having a sickle cell trait or not. And if you are having sickle cell trait, your partner should not be having a trait, because you also have to suffer and your child also have to suffer from it, right? So it's a request that before doing this pre-wedding shoots, just do pre-wedding medical checkups. It will be very helpful for you and for a society, healthy society.